My name is John Swartzberg, and I'm pleased to give you a little preview of our talk today by Professor Richard Scheffler. The topic is monetizing medicine, how private equity is changing who your doctor works for and what it means for you. It's really an interesting and terribly important topic. Looking forward to hearing what Richard has to say. Let me briefly tell you a little bit about Richard, although I suspect many of you know him. Richard has really devoted almost his entire career to UC Berkeley, the state of California, and also to the United States, and actually even worldwide. His work on health economics is well known throughout the world. Richard's a distinguished professor of health economics and public policy at the School of Public Health and the Goldman School of Public Policy. He also holds the chair in healthcare markets and consumer welfare endowed by the Office of the Attorney General for the state of California. And he's also the director of the Nicholas Petris Center on Healthcare Markets and Consumer Welfare. Richard has published over 200 papers and edited and written 12 books. And since his official retirement, that is going into the emeritus status in 2018, he continues to be a prolific writer and editor, and continues to make enormous contributions to our campus and the University of California system and our community. So Richard, the floor is yours.
Thank you, John, and pleased to talk to my colleagues about monetizing medicine. Before I dive into the private equity part of this, I thought I'd give you a brief background for those who have not studied healthcare, so you have a framework in order to see what private equity is doing. So I'm going to focus first on who owns the healthcare system. The ownership of the healthcare system has various components. None of these will surprise you. The biggest component of the healthcare system is hospitals. And most of the hospitals in the US are set up nonprofit, and they're about 30% of the healthcare system. There's basically two kinds of nonprofits. One is the public nonprofit, and that would be UCSF, for example, our sister school. And then there's the private nonprofit, and that would be our rival, Stanford. But they're both nonprofit, which means no one really owns them in theory. The community owns them. And they're run by a board, a public board, usually citizens of note who help to guide the hospital and hospital system. They are given special tax status, that is, they don't pay income or real estate taxes to help them along. And in order to get that tax benefit, they sign what can be called a social contract, which says to keep that nonprofit status, they promise to do good things for the community. What would they be, for example? They might be things like providing educational programs for children or for those who have diabetes and the like, all free at the hospital. They also provide charity care for those who can't afford hospital or physician services. Each one of these contracts is different in different areas for different hospitals, but they all have a social contract. The rest of the healthcare system, the other 70% plus of it, is set up on a for-profit basis. So the healthcare system is a capitalist system where people work in it and the owners make money off of it. One component, of course, is the nursing homes. And they are 90+% for profit. Most were originally set up by physicians, little mom and pop operations to take care of elderly people. Now they're mostly owned by large corporate bodies. Everybody knows the pharma industry. Pharmaceuticals is for profit, and they're about 10% of the healthcare system. Dentistry is around 4%, that's for profit. And I'll focus a lot of my discussion at the very end about physicians. And the physicians are about 20% of the healthcare market, and they are definitely set up as a for-profit enterprise. So how is the healthcare system financed? First, I think everybody knows it's huge. Last figures say that the healthcare system is about $4.5 trillion and growing. It's about 18% of the gross national product. So it's close to 1 out of every $5 spent in our entire economy is spent in healthcare. Who pays for it? The federal government pays about a third of it. Households pay about 23%, businesses about 18%, and state and local governments around 15%. So it's a public-private mix of governments at the federal, state, and local level, the business community, and household individuals like you and I who pay for the healthcare system. And so how do we organize? How have we organized our healthcare system in the US? Well, it's set up with a public-private mix. It's set up on an insurance basis, as we all know. At UC Berkeley, we have pretty good commercial insurance. When we were faculty members or staff. And now most of us are, of course, on Medicare, which is the federal government share of it. So the private healthcare system that we were on when we were working at Cal is about 30% of the market, and Medicare pays around 20%. And then we have a program for the poor, basically a needs-based program called Medicaid. It's called Medicaid in every state except California. We call it Medi-Cal, but it is Medicaid, and it's financed by a mix of money from the state of California here and the federal government. It's pretty close to a 50-50 match. The federal government will give poorer states more money and richer states less money. And then about 10-11% of it is out of pocket. So there you have the kind of nuts and bolts of the healthcare system 101, just to give you a sense of who owns it, who pays for it, and how it's financed. So I'm going to focus a little bit on the physician practice. And first, many of you haven't thought about this, but your doctor that you're used to seeing, who for the most part about a decade ago were, small practices or group practices, are set up as a business. As John knows, the business of healthcare is you rent a space, you hire nurses, assistants, secretaries, accountants, and you you bill the insurance companies or Medi-Cal or the government for the services. And at the end of the day, at the end of the tax season, whatever is left in that small business, that's your income. So the income of physicians basically is for profit, has been running a business. And the business has been pretty good. Physicians in the United States now make around, on average, $240,000. Not a bad business. And specialists make 3 or 4 times that. And so it's been a pretty profitable business. What's happened in the last decade is a lot of the smaller physician practices have moved into larger medical groups. So instead of having 2 doctors or 5 doctors in a practice, there are now practices with 50 or 100 or even 300 or 400 doctors. And is partly driven by the fact that medicine has become more corporatized, and physicians need to negotiate with insurance companies, and better to be bigger when you negotiate. They also need more money for equipment, which has become much more expensive. And so the practice of medicine has changed dramatically. So today now, private equity, which I'll describe in a moment, owns about 30% of the physician practices in the United States in metropolitan areas. And it's been skyrocketing in the last decade. The specialties that have gotten most of the attention have been dermatology and urology and cardiology, technical specialties that require a fair amount of equipment and investment. More recently, primary care physicians have also been bought up by private equity firms. So then you might ask, what is a private equity firm anyhow? So a private equity firm is a firm set up to make investments. This is different than Silicon Valley, where you have venture capitalists, which obviously we all know because it's had an amazing impact on where we live and the Bay Area and Berkeley. Venture capitalists give money to individuals who want to start a business or have a business idea. Private equity firms are different. They are there to purchase existing businesses and run them more for profit. So this model has been exploding throughout the economy. To give you a sense of that, in about a decade ago, the assets managed by these private companies, which are heavily located, by the way, in San Francisco, was about $2.2 trillion. It's now over $8 trillion in just a decade. So it's gone up 4 times. Who are the investors? Where does the money come from these private equity firms for them to use? Well, they come from endowments that people have, and the University of California has endowments. They actually give money to private equity firms. Private pension funds give them money, and wealthy individuals give them money. It's been a very good model. In the last 10 years, private equity investments have gone up 50% more than the stock market. 50% more than the stock market. And if you think that's startling, in the last 5 years, private equity returns and investments have gone up 4 times faster than the stock market. So it is a sizzling way of making money. It obviously has more risk, but the average rate of return to private equity in general in the economy has been astounding. So why are we worried about it? And what's different about private equity in healthcare? Well, the private equity model in healthcare has some very unique characteristics that raised my eyebrows and have raised concern from the White House to the Federal Trade Commission in Washington to the Attorney General's office and the legislature in California. And I'll touch upon each one of those. So what would be a private equity model in the physician market? And the first question that's asked is why physicians would sell their practice. So there's at least three major reasons why physicians now in medical groups sell their practice. And part of it is they need capital, and they need to have the ability to negotiate with the insurance companies, which are big now and highly concentrated. A lot of them need money for new technology and equipment. But even more interesting is the physician supply we have is old and aging rapidly. Right now, 30% of the physicians in the United States, including John Schwartzberg, are over 65. And in the next 10 years, 40% of them will be over 65. And so they're looking at retirement. And if they sell their practice to a private equity firm, they will get a lot of money. How much? Well, if it's a primary care physician, their practice will sell for $2 to $3 million per physician. If it's a specialty practice, it'll sell for 2 or 3 times that per physician. So that would be $5 to $8 million per physician. So if you have 20 physicians in your practice, you can be looking at 100 to $150 million. And if 30 moving to 40% of them are over 65, that's a good retirement bundle. So physicians are interested in selling their practices now, like they've never been before. And at the same time, we need physicians because we have a physician shortage in the United States. And so the market is quite good for physicians and the ability to make money off their practice. So here we have it now, a private equity company, call them the Bane Company. That's a big one that's located in San Francisco. Their goals are different. So they now have gone to John Schwartzberg, who's the head of the practice, and said, John, here's 100 million or 150 million for your practice now, and we own it, but here's the money. John says, well, that's really good. I like that. But now we control the practice. Well, how do they control the practice? Well, they decide how many nurses they're going to hire, what equipment they're going to buy. And also they put pressure on the physicians working there to put the profits of the practice over the health of the patients. We know that there was this social understanding that physicians who signed the code and an oath, Hippocratic oath, Hippocratic, yes, one of those two, they were supposed to put the patient before the profits. And I think many of them, and probably most of them did. But now they're working for a private equity firm that says, if you don't do this, you're going to be looking for a job somewhere else. And maybe the senior physicians like John don't care, but there's still 70% of the other doctors who are on 65 or over. And so they have a lot to do with how the practice operates. Their goal is to make short-term profits. So what they do is they will sell the assets of the practice. If the practice owned a building or land, they'll sell it, take the money, and then they'll just lease it back. Uh, and that's a clear profit for them. They'll cut staffing and sell other assets of the practice. And their goal is to sell the practice and focus on profits and to sell it in 3 to 5 years. Now, there's a lot of research out there. I've done a lot of it. I sent you one of my reports. There are others, of course. But what we find generally is, not surprisingly, that the quality goes down. As you cut staffing and nursing and the like, the quality level goes down. Patient safety goes down. When they buy a hospital, for example, there's more infections or readmissions. And the prices in the practice go up because they have some market power in certain areas where they have bought a lot of physician practices. They can raise prices, and the Federal Trade Commission, based on some work that I've done and others, now investigating private equity firms for antitrust violations and raising the prices of physician services and other services. I don't know if anybody remembers, but about President Biden's first State of the Union address, he had very little to say about healthcare. It wasn't a priority. But he did say one thing. He called out nursing homes. And he said private equity firm purchases in nursing homes uh, was resulting in lower quality, and studies show that 20,000 people died in nursing homes that were bought by private equity firms because they cut staffing levels of nurses, for example. So we've seen lots of things at the federal level and committees and hearings. The Federal Trade Commission is now looking at antitrust violations and has major cases in private equity firms in Texas and in Massachusetts, for example. But California, not surprisingly, is at the forefront of this. And so there was a bill introduced in the legislature February 16th by the Attorney General, Robert Bonta, and the Speaker pro tem, Jim Wood, from Hillsborough. It is the most aggressive, forward-looking piece of legislation. And what it says in sum is that private equity purchases, all of them in healthcare, would have to be approved by the Attorney General in writing. In other words, this was not an acceptable market to use capitalism and private equity in healthcare because of its impact on patient safety and raising prices, and they were out here to protect the public. So there are certain things in capitalism that work, and there's nothing wrong with private equity, but overall, but in healthcare, it's a very, very bad fit. We make moral judgments in healthcare. For example, we don't have an active market for selling body parts. you can't buy a heart or a lung. You can donate them, and then there is a system to allocate them. But believe it or not, there are other countries in Europe where you actually can buy a body part. Uh, and so in the United States, the moral position of people in healthcare is that private equity model is destructive. It raises prices. It puts patients at risk, and it needs to be heavily scrutinized. The last thought I leave you with is that you probably don't know that you're a physician practice, a physician thing, or would you have to be told, was actually bought by a private equity firm. There is no legal requirement for you to be told that. But once it's bought by a private equity firm, the model of putting patients first falls apart and profits are put before patients. And so one of the things that I've been really strong about is transparency, and to try to let patients know that their physician now works for a private equity firm.